it's what it's what the stress that we might just put into it right now. And because I also have a story that I have to tell about it. It's a time where we eat a lot of chocolates and we're gifted with a lot of chocolates and sweet things that makes us feel good about ourselves, because that is one of the ways where we share love. And we want to also ask the doctor if doing this is okay for us all the time, or we should just make it some exceptional days where we can enjoy those chocolates. So I'm Adesitu Afolabi, the boss lady at Wellness Healthcare Group. I'm a wellness coach, so this is very important to me. One of the ways in which wellness is reaching out to the community is also through education, and education about our health. Last month we did something. We did a topic about achieving and maintaining weight, and the doctor actually. I must tell you that I don't know whether it was the truth in the webinar, but YouTube actually pulled our webinar down. I don't know whether it was the truth in the webinar, but she told us something very important. And she said that of all the weight loss exercises and weight loss programs, she said the most important one is for us to achieve portionability. Take little at a time. You don't have to eat to fill your tummy. Eat the well-nourished meals, but don't eat so much. And she also said that our body always strives to survive, every cell in our body. So the best thing for us to do is to eat the right meal so that the body can survive. So we don't just live, we survive and we thrive. So today we're going to talk about does eating sugar cause diabetes, doctor, and we'll need your honest feedback in helping us to clarify some of the issues that's bothered us. Wellness has done this for the last 1 year, and we're glad that we've impacted lives. We're glad that people have given their testimonies on what they've done. And don't forget, we all said that by the end of this year, we'll ask ourselves how much weight have we lost. I've lost 3 kg, and I'm very proud of myself. But the doctor said I should not just be happy with losing weight. I should make up my mind to achieve that weight. So the struggle continues. So today I'm going to be working with Dr. Olopade. He's a consultant physician. He's an endocrinologist. He's a seasoned one and well known, because as I was sharing the link with people, people were saying, "Oh, they know him. Oh, he's my doctor," and all that. So, Dr. Olopade, thank you for what you do. And of course, Joshua is also here with us. Joshua is one of the people that help us to reach out to a special group of people that might not hear us, but they see what he does and they are able to comprehend what we're doing right now. So, thank you, Mr. Joshua. Thank you for coming on board. And for everyone that is watching right now, please don't watch alone. Send a link to friends and family. And diabetes is a serious issue, and the earlier we understand it, the better for us all as a people, because the wealth of a nation is actually dependent on the health of the people. And that's why some people tell me that they want to leave Nigeria just because of health, just because they want to be in a facility where they can take care of them. So whether the economy or the infrastructures in Nigeria can take care of us is a secondary issue. How can we take care of ourselves so that we don't need to be caught up in looking for help while we live, especially when there are things that can be prevented. So, right on with me. Don't forget, please, to share this. We've also received your questions. If you still have questions, don't forget to share it on the chat box. My team will send the questions to us while we're doing this. So thank you very much, Dr. Olopade. Are you ready for us?
Thank you. Good morning, and good morning, everybody.
Okay, so I will start with this question, Dr. Lopari. What is diabetes, and how can someone know that he or she has diabetes? What is
Okay,
diabetes?
thank you for the question. Diabetes mellitus. Let me just try and simplify it. It's a metabolic problem, and which results in chronic level of or high level of glucose level within the bloodstream, which persists for a long time, and this is as a result of deficiency of insulin production. And because of this deficiency of insulin production, it leads to disorder of carbohydrate, protein, fat and oil, vitamin, water, and water. And this condition generally can be identified or diagnosed when people have high glucose level in their bloodstream, which is greater than 126 milligrams per dl. So we'll be talking about numbers today, really. So you need to understand what these numbers mean. So 126 milligrams per dl, that is in a fasting state on 2 consecutive occasions. When you have this, then you can say that individual has diabetes mellitus. Then apart from that, if someone has classical symptoms of diabetes mellitus, such as polyuria, polydipsia, polyphagia. Now, what does that mean? This simply means when you're eating too much, or when you're drinking water too much, or when you're eating too much.
Dr. Lokwade,
Yes.
we need to break it down in the
And
simplest.
that's what I'm trying to
So,
break down.
you have told us what diabetes is, and you said
Yeah.
that it's a metabolic problem.
Yes,
So it has to do with our digestive system or
definitely.
the breaking down of meals of
Breaking down
food
of meals, but it's beyond that, really.
is beyond that.
Yes.
Okay, and you said that it's a metabolic problem, and it's typified by chronic level of high blood sugar,
Level.
which is due to deficiency in insulin production. So
Yes.
you said one of the ways we can know someone can know that the person is diabetic is to check the blood sugar level in a fasting state. Fasting
That's
state
just
meaning
one
that
out of 4 ways of checking.
okay, so fasting blood sugar means that you have not eaten.
At
So
least
what
8 to 14 hours from the last meal.
14 hours to the last meal. That's the fasting.
8 to 14 hours from the last
8
meal.
to 14 hours from the last
Yes.
meal. So Dr.
Yes.
Lopade, when you say 8 to 14 hours to the last meal, and you said that when that person checks that blood sugar, so that means it doesn't mean it's not necessarily checked. It shouldn't necessarily be checked in the morning. Fasting blood
Very
sugar.
beautiful way of deciphering what we're saying. So, for example, if you have not eaten, if your last meal was 7 a.m., you can check your fasting in the evening. It's possible.
Okay. So it's not just about 7 a.m. to 9 a.m. That
But yes, I agree. So, but the commonest period is just from your last meal
okay.
in the morning, then at night, then you check in the morning. So we want it to be between that 8 to 14 hours. That's the ideal period
Okay, because
from your last
automatically
meal.
we fast when we sleep. So
Yes.
now you have ruled out something that is not necessarily done in the morning because people have that difficulty in checking their fasting blood sugar between 7 and 9. And somebody is saying once it's after 9, that is not important. So the fasting state should be between 8 to 14 hours. And the milligram ideal is should be at least less than 126.
Now, so the issue is this. There's also another caveat in that area. The normal
Okay.
glucose value you should know is between 70 to 100 milligrams per dl.
Okay.
Now, that's depending on the criteria you're using. If you're using World Health and International Diabetes Federation's criteria, it is between 70 to 109 milligrams per dl. Now,
Okay.
other stakeholders use between 70 and 100. So,
Okay.
whichever figure you want to follow, you can choose. So, between 110 and 125, we call that impaired fasting glucose level.
Okay.
You understand what I'm saying? So 21, 26 and above is diabetes range.
Okay. Okay.
Okay, so you need to get 2 consecutive values of that fasting state for you to say that individual has diabetes mellitus.
The two consecutive values, can it be today
So
and tomorrow?
yes, so that you found one today does not mean, and if it is normal the next day, then you need to further monitor that individual, evaluate, and see maybe the person has pre-diabetes.
Okay. Okay, so it's not a one-off thing. If you check once, you have to check the next day at
Yes.
least for you to be
Yes.
sure.
So next day or for subsequently maybe next month, next week, depending on, but you need to have 2 consecutive values for you to say, oh, this person has
Diabetes.
diabetes mellitus. Yes. So that's just one way of making diagnosis. Now,
Okay.
second way is to find out if someone has excessive symptoms of urination, or excessive drinking of water, or excessive eating more than the way the person used to eat before, or unexplained weight loss, or waking up at night more than 3 times at night, and waking up to urinate at night more than 3 times. Then, in this setting of these symptoms, then the person does a random glucose value, or what you call a casual glucose value. You just check your sugar level at any particular point in time, and it's greater than 200 milligrams per dl. Then you can say that individual has diabetes mellitus.
So the first one is fasting blood sugar. The
Yes.
second one is the
A
symptoms that the person
random
has to say.
symptoms.
So excessive urination, just like
Yes.
marketing has 5Ps, 6Ps, and 7Ps. So diabetes also has its own Ps,
Yes.
3Ps or 5Ps. I don't
Three
know
P's.
polyuria. I know
Is
polyuria and all that. So when
yeah.
somebody
So
is drinking excessive water, that person should begin to wonder
urinating too
why.
much,
Urinating too
eating
much,
too much,
eating too much, and if the person is emaciating,
unexplained weight
that means
loss.
person unexplained weight loss,
Yes.
then
Then peeing at night more than 3 times,
to urinate.
waking up frequently to urinate at night. So that could be a pointer towards diabetes. Then with in the setting of random glucose value of 200 and above.
Okay, so for anyone having these symptoms now, the person can actually go and do a random blood sugar test. That is
Yes. A
why
casual
whether
glucose
you've
check.
eaten or you've not eaten, just go and do the random sugar test. And if it's above 200 milligram per
Milligrams per
DL,
day.
then that person is diabetic.
Yes.
Does the person need to do it twice or thrice or just
No,
one
no,
of
no,
them?
no, no, no. The moment it is greater than 200, that means the person has diabetes. Then it's also better for the person to see a physician or a doctor to help.
Okay.
Then another way to also make that diagnosis, even if there's a doubt, you're having the symptoms, but you didn't even find this random glucose value above 200, you can do a test called oral glucose tolerance test, which a doctor will prescribe for you. And this oral glucose tolerance test is done with using 75 grams of anhydrous glucose. Now, the problem I have with this test in our environment is that many labs use glucose D instead of anhydrous glucose. So they cannot be measuring the same amount of anhydrous glucose and the same amount that we use for anhydrous glucose with glucose D. If you're going to use glucose D, the amount differs from the amount you use for anhydrous glucose. So when you give this glucose, they give it as you put it in water, mix it, and the person drinks it over 10 minutes. And glucose value is checked at 0 minute before you drink, then at 2 hours. So if the glucose value is greater than 200 milligrams per day at 2 hours, then the person can be said they has diabetes mellitus.
So the oral glucose tolerance test is another thing that is
So it's
being
a
used.
yeah, so it's a
Okay.
dynamic test to find out to stress that's to see how the pancreas can cope in handling
With
glucose. So,
okay.
but however, in doing this glucose test, there are certain instructions that will be given to that individual. Instructions such as abstain from alcohol, smoking, then take good carbohydrate diet of at least 150 grams over 3 days, 150 grams per day over 3 days, so that by the time you're giving this, at least we know that the pancreas is able to undergo this stressful period, because it's a glucose load you're giving at that point in time to stress the pancreas to see how it will respond to the glucose load.
Okay. So are those the only three ways one
No,
can
so the fourth one is a test called glycosylated hemoglobin, which we
glycosylate?
abbreviated as HbA1c. So if you have a value of 6.5% and above, then you can say that person has diabetes mellitus. But another thing you can also use glycosylated hemoglobin to do is to also find out if you have pre-diabetes. Because if you have value of 5.7 to 6.4%, that's in the pre-diabetes range.
Okay. Okay, so even when someone doesn't have the symptoms, one can actually go and do the glycosylated hemoglobin to see if you're fine, because you
Yes.
might not have symptoms, and the fasting blood sugar could give a very good result. And meanwhile, the person is actually knocking on the door. So is
Yeah.
diabetes hereditary?
Diabetes can be, yes, can be, because you find out that it can move, it can, successive generations can definitely have diabetes mellitus. Classic example, for example, my grandmother, my late grandmother had diabetes mellitus, and I never knew. She died before I was born. And my dad eventually didn't come down with diabetes mellitus until he was 75 years, because he knew and he never told us even at home. So what he did was to ban sugar in my house right from when I was small. So there was never nothing like sugar in my house. And all of a sudden, when he came back with diabetes mellitus, I was wondering, I said, Dad, is there diabetes in our family? Because all what I know was that there was no family history of diabetes mellitus. But he now said the mother died of diabetes mellitus. That's what. And I said, oh, how did you know that he died? He said, whenever she pee, ants always come to wherever she pees. I said, you didn't tell us now. So, but however, so it can be. So you can also work towards preventing it. So he worked towards preventing it till the age of 75. And as much as possible, because he was making sure he was eating well, preventing, and not, he never took alcohol, never smoked. So he did a lot of things to prevent. But now he's well controlled. He's using glucose anti-diabetic agent just once a day, and he's doing well. He's able to eat any meal he wants to eat, and he's 84, so he's doing well.
Okay,
So
so
he can move. So the question is that it can run in families. It's possible because there's a genetic component to it, really. But you only need a trigger, environmental trigger, to activate it. And those are what we call the risk factors for developing diabetes mellitus.
okay, so one of the things you said about being hereditary and the fact that your daddy banned sugar. So I'll give you an instance.
Mhm.
So my dad consumed a lot of sugar before he died. So my dad takes tea at least once a day, and that is about 200 mils of water, and he used 5 cubes of sugar. He only used cubes sugar. Then he takes either a bottle of malt or a bottle of Fanta daily. He never had diabetics.
Beautiful, because
Then
it does not have the genetic basis.
then my mom, even when she gives you sweet, she'll give you agbojedi immediately to neutralize it. We saw my mom as someone that will not put sugar in her tea. She will not put sugar in her pap. She practically does not eat sugar. You know that this woman doesn't like sugar. She does not enjoy taking sugar. And she had diabetics. Of course,
Okay.
already a bad case because we knew, because she was emaciating, because she was almost close to 70. She was emaciating, she was losing weight and all that and all that. I just went to her house one day and I saw urine, and I saw hands in the bathroom, and I was like, what is happening here? And it just occurred to me that she's emaciating. So we went to check the blood sugar. The fasting blood sugar was 400 and something. It was crazy.
Mm.
So that's why I want us to clarify that this abstinence
Yes,
from
sure.
sugar and this diabetics, what's the correlation? What can you help people with?
Okay, so that somebody has is consuming sugar does not mean that he's going to develop diabetes mellitus, like what I've just said, because there's genetic basis to diabetes mellitus. So definitely that's why it can transfer it from one generation to another. So, but when somebody has the tendency to have diabetes mellitus, we call that risk factors or family history for diabetes mellitus. And there's an environmental trigger. So that's why we say the cause of diabetes mellitus is multifactorial. It's
Hmm.
beyond one factor, and it's a complex disease. You cannot say this is what is going to make it. It's not 1 + 1 = 2.
Hmm.
So you need a trigger. For example, you have a family history of diabetes mellitus, then you indulge in physical inactivity. The person is already inviting diabetes mellitus because you need to be active. You need your muscles to be active. You need to burn fats so that you have more muscles that will help to burn your glucose level. Or that person has a family history of diabetes mellitus and is consuming alcohol excessively, is smoking. Definitely, that's an environmental trigger that will definitely trigger development of diabetes mellitus subsequently. So we must be careful. We must be careful about when you have family history or tendencies to have diabetes mellitus. Then you must avoid certain things which other people can easily do. So because there's nowhere in medical textbooks that will tell you that sugar causes diabetes mellitus, but it can worsen the state of those who have diabetes mellitus. You
Hmm.
know what I'm saying? So there's no, because it is not that it is sugar that is causing diabetes. No, because they say because the definition is chronic high glucose level. Yes, but that doesn't mean that it is now the sugar that you've consumed that is triggering it. We're not encouraging people to continue to take it because when you continue to take it too in high amount, in large amounts, you are stressing your body. And mind
Hmm.
you, when you take all these things too, your body, after using the normal glucose load that the body needs, it stores it as fat within your system. The glucose that you've taken when it's in excess amount can be stored as fat. So we should also remember that when you begin to gather fat in your body system, you begin to generate or you begin to have tissue that can prevent insulin from being used in an effective manner. So because fat itself causes what you call insulin resistance. Insulin resistance means inability of insulin to be used properly within the body system. So that's why overweight and obesity is also a risk factor for developing diabetes mellitus. So what are we saying in essence? Consuming glucose in excess amount, whether fizzy drink, whatever you're calling it, can help you to gain weight. And in gaining this weight over time and you develop obesity, can be a trigger for developing diabetes mellitus. So that's an easy way.
To explain it. Thank you, doctor. So there is no textbook that says consuming sugar causes diabetes.
No.
But if you have that risk factor, you have hereditary disposition to having
So,
diabetics. If you do not consciously live your life, you might those environmental factors can trigger that state of and the person now can now come down with diabetics. So eating
yes.
sugar does not cause diabetics, but you don't know. Just like you didn't know until your dad had diabetics. If your dad never had, then it will be in the history, but also until somebody else now have. So now I need to be very I need to be very careful eating sugar now so that I don't trigger the hereditary factor
Yeah.
of the
So
body.
so
No,
we have to just be careful. So as much as possible, prevent so many risk factors. For example, you have a lot of risk factors that are in place really.
okay.
And there are newer ones coming up almost on
Every day.
yearly basis. Yes, you will be surprised that even when we talked about OGTT, you can also use OGTT to diagnose what you call impaired fasting glucose level. That means when your fasting level is between 110 to 125, that's impaired fasting glucose level. Those individuals, we call them pre-diabetes too. They have tendency to go into diabetes state. Then you can also reverse it if you are meticulous about your lifestyle and readjust your lifestyle or modify your lifestyle. You can reverse it. Then there's
Okay.
also what's called impaired glucose tolerance, where the glucose level is far above 126, but less than 200. That is a form of impaired glucose tolerance too. No, sorry, 140 and less than 200. So you expect that those individuals to also they can go to into diabetes state, but they can also reverse it if they adjust and readjust their lifestyle. So that's
Wow.
one way. Now for women who have tendency to develop diabetes mellitus, they should watch out because pregnancy too, you know what you call the pregnancy hormones, they are betogenic hormones too. So that's why you see people having diabetes in pregnancy. We call that gestational diabetes mellitus. And
So they always tell women. I remember when I my first pregnancy, my mom was telling me not to consume so much sugar that I might come down with diabetes and my baby will now have diabetes. So of course, I was like, mommy, I rejected it immediately. I was like, what kind of what kind of and you know when you're pregnant, you just want to eat what your
you're craving for everything.
yeah, it's what your mind desires, not just what. And it was tough then, and I think I was really scared. I read some things about it, and I read about gestational diabetes. I realized that it's not just the sugar alone and all that.
No,
But
it's
maybe we'll
beyond that.
talk about gestational diabetes in the course of this, so that people can also know what to do. So what you are saying is that when people are in the pre-diabetic stage, or they just got diagnosed, they can reverse it.
It's
They can
possible,
reverse the
especially
diabetes
the
state,
pre-diabetic states. You
the
can
pre-diabetic
adjust your
state.
life. Yeah, you can adjust your lifestyle. Do away with certain things that could trigger you or push you into diabetes states as much as possible. So you need to exercise more. You need to then look at your diet, then readjust it. When it comes to issue of diet, there's a lot to diet. In our environment, we don't have any standard measures. Compared to the Western world, you can get to supermarket and you see the number of calorie on the diet. But in this part of the world, where is the diet for? What's the calorie content for the amala there by you are eating? There's no, so everybody takes whatever portion they want to take. So it's so difficult for you to say this is the quantity that will give you maybe 50 grams of carbohydrates. So difficult because we don't label our meal and
Meals.
we prepare it ourselves at home. So in an environment, so that's where you now need to use your discretion, you individualize treatment. When you're talking about diet, you need to know what the quantity by estimation sometimes. Or if you're able to do it, that's where the dietitian comes in, so that in a practical state, when I as a physician prescribe my dietary, and when I give my dietary prescription, the dietitian will assist me to implement it with the patient, so that they can know the quantity we want them to achieve. Although there's some rough guide I do in clinic, which has helped over the years for me. But however, we need to also understand that there are certain food that can increase your sugar level in a faster rate, at a faster rate, compared to others that increases your sugar level at a slower rate. So we encourage people to take those ones that will increase it at a slower rate a little bit more than those that increase it at a faster rate. For example, bread is known to increase your glucose level fast. Bread is even almost equivalent to glucose in terms of
Wow.
glycemic index. So yes, rice is known to be a high glycemic index meal. It's as if rice has become a staple food in
Yes,
Nigeria now.
we eat
So
a lot.
I don't know whether rice is also part of our issues. We need to know. We need to find out. We need to do studies. We need to
I think we eat a lot
monitor
of bread
ourselves.
and rice.
Yes, in this environment. And on top of it, you take a bottle of Coke on top of it again. So maybe that's why we're seeing more of pre-diabetes and diabetes now, because the prevalence figures gradually has been rising. In the last 2 years now, the prevalence figure for diabetes in Nigeria is 5.77%. That was a meta-analysis study done by Iloko et al. And you find out that the highest prevalence of that, they analyzed all the studies in Nigeria using the 6 geopolitical zones. And they realized that the South zone has the highest prevalence, which is 9.9%. That means what you're saying is that almost when you gather 10 people together, almost that's 1 out of 10 in South has diabetes mellitus. Why the Northwest, the Northwest has the lowest prevalence, that is 3.8%. So we have a lot of issue on our hands, and we don't have a lot of awareness on diabetes, because diabetes is fueling a lot of things. Now we're seeing people coming down with heart attack, find out there will be some form of abnormal glucose level or diabetes beneath it. So you are seeing people coming down with people. And funnily, another thing I need to even mention, a major risk factor for diabetes is hypertension. You will not believe that, but
Hmm.
hypertension is a big risk factor for diabetes. And those two, they are like Siamese twins that you don't want.
Hmm.
People that have hypertension should begin to screen themselves periodically to see whether they have abnormal glucose level or a tendency to develop diabetes mellitus. So that's a big issue in the environment. And if you look at the prevalence of diabetes, hypertension, almost 1 in 2 people have hypertension in Nigeria from the age of 40 and above. So it's a big issue.
Almost 1 in 2 people. That's a
So
very
we need
serious.
to, so
That's
we need
that's
to,
that's a very serious
yeah.
matter.
So it's a serious issue.
So, doctor, how can you help people accept that they are diabetics? I've had to counsel people to accept that they are diabetic. How do you help people to accept it? Because
Um,
sometimes people don't just stop at what you told them, they just extrapolate, and somebody is just thinking about the complications immediately. So, how do you help people to accept that they are diabetic?
so it's a difficult thing to accept, really. There's nothing enjoyable to say somebody has a problem, really. So people leave. That's the first thing is to go into denial. And in an environment, thank God, the way you even said it the other time that I reject this, that's the first thing you're going to hear. So, but however, what we can do is, if you have advocacy, awareness, issue of clubs, diabetes club. For example, we have Diabetes Association of Nigeria, and we have a lot of people with diabetes in this particular association in this country. They're available in all states. This association has branches in all states of this country. That's a form of a group that can help people to know what people with diabetes are experiencing and how they can easily understand what people with diabetes pass through. So if you have that kind of group and you introduce people to this group, it may help and it may work. Another thing is to empathize with people and make them to feel that to make them to understand that you're also feeling what they're feeling, or and even share experiences with them. It may help. because it is not easy to accept that people, you're telling somebody that you have diabetes mellitus and just going to and is going to be on drugs for his or for the rest of his or her life, and they will accept easily because people are looking for solutions, things. And again, diabetes mellitus is not a condition that you should take light, because by the time you're making diagnosis of diabetes mellitus, especially type 2 diabetes mellitus, which is about 90% of 90% of the type of diabetes mellitus that we have, there's already complications that are already in place by the time you're making that diagnosis. So what you are doing as a doctor, as a physician, is to prevent further complications, which people don't even understand. It's not like hypertension that you're making that you just find out that the person, some other disease condition, the way you find out, and the symptoms just came up and there's no complications. In making diagnosis of diabetes mellitus, there's underlying complications that are there. Whether these my complications are macro, the ones that are affecting big vessels, or the ones that are affecting small vessels, they are already there. So you need to quickly move on time to start treatment to prevent for that. The truth is, the moment you can start managing these individuals, you can prevent or retard the progression of these complications that we're talking about. So it's always good to quickly get these individuals to understand that this medical condition is something that they need to quickly start treating. So that's why it is essential to quickly get them out of the state of denial as soon as possible. Sometimes you may need to bring in, if they need to bring in a trusted partner with their consent, so that we can work them into making it accept the line of management. Then it is essential. You can do that.
Okay, so this is becoming scary because when we had a session on hypertension, the doctor also said that at the point where you're being diagnosed, that it's already some level of complications going on. And so the same thing with diabetics. At the point that the person is now diagnosed as diabetic, there is a level of complication going on. So
Especially with the big vessels.
especially with the big vessels, that
So
means
that's why you're seeing somebody will just collapse and say he has a sudden heart attack, because the heart attack is more of a big vessel disease. But by the time you not see the patient, you're screening, or you're in a critical emergency state, you're screening, you're finding out that the glucose value is very high. So the issue now is you don't need to wait until your sugar is high. What you need is periodic screening, opportunistic screening, to find out, especially if you have tendency, family history, or you have the risk factor for diabetes mellitus. Please just go ahead and do periodic screening. Screen yourself regularly.
okay, I think one of the things that everybody needs to come to terms with is that there are some non-communicable diseases that are very serious and one has to pay attention. The
Yes.
two most common ones, hypertension and diabetics, everybody needs to make up their mind to screen for it as often as we can. Because at the time that you are moving from pre-diabetes to diabetes, you're already having problems. For hypertension, so there is pre and there is hypertension. So
Yes.
everybody on this timeline, Dr. Olopade is also reiterating that fact that as we grow older, especially now you don't have to wait till you are 40 because people in their 30s are already coming down
Even
with
things.
diabetes.
That's even shocking.
So even when we give sugar to a lot of our children, and sometimes if we have a hereditary disposition, we should also look at it and not just spare them. We should not wait till, because it's saying teenagers are also coming down with diabetes, and this is a serious matter. Remembering the fact that as at the time you are being diagnosed as having diabetes, you're already having complications, and that makes it a very serious matter. So it's something that one has to pay attention to.
Sorry, let me just add something to what you just said again.
Yes,
Another
sir.
thing, especially to we as parents, we want our children to be well nourished, which is good, but childhood obesity is not good. We must prevent that, because that's another risk factor for children to come down with diabetes. So developing childhood obesity, we should, as much as possible, make them to be active, not gaining weight unnecessarily in childhood.
My well-fed baby. It's not just about well-fed baby now. The
Yeah,
baby should be well-fed but not obese. Wow, that's
preventing
a
that.
work for parents too. Okay, so now that we've established that eating sugar does not cause diabetes, we also realize that diabetes can be prevented. So for as many people that have not been diagnosed of diabetes and hypertension, just like the doctor that we had before also said, then we can actually prevent that phase so that we don't run into complication. And acceptance is that once this has happened, we need to make up our mind to solve the problem, and not just live in denial. Because the more we live in denial, the worse the situation
Can
becomes.
be.
Wow. Okay. So now we know we can delay and we know we can prevent. And we talked about, you said lifestyle modification. I know you've mentioned smoking, you've mentioned alcohol. You also mentioned that inactivity can also be a very big factor. Yes, obesity is a problem because if the large vessels, the fats, you said the fats actually also increase insulin resistance. Insulin is what helps to break down the sugar we take. So if it's not breaking down the sugar into fat
So
and other
it
things,
you know it helps to transport glucose into your tissue, your muscles,
okay,
so that your muscles can burn them. So when
okay,
you have a lot of fat, it's going to prevent that transport, glucose entering into your muscles that you need to use to burn them. And for example, if you gain more weight, that means you have more fat. So if you have more fat, you're going to have less muscles to burn this glucose. So that's why exercise is essential, so as to can build your lean body mass, so that it can burn fat faster
so so
use
so
use of
diabetes,
your
diabetes
glucose.
could be as a result of logistic problem in the body as well.
There's a
Because
lot.
something is preventing the penetration. So the sugar stays
So
in
so
the
so
blood
so,
instead
so
of
for those who
entering.
have fats, really, you require a higher amount of insulin to overcome that resistance. That's the issue. And by the time you're making the diagnosis of diabetes mellitus, mind you, at least 50% of the cells producing insulin have been destroyed.
Wow.
So that means the 50% that is remaining, they are doing the work of two people instead of one. That's the way I will explain that.
So that's
So
that's automatically stress that we're putting on the
thank
body.
you. So there's that we call that beta cell stress. And after that stress continues for a while, it leads to exhaustion. And following that exhaustion, some of those cells will begin to die. So that 50% begins to reduce too over time. And that's why oral pills sometimes begin to fail. So that's why we now begin to say, oh, you will need insulin to be added. So when we begin to say insulin is not needed in managing this in people with diabetes mellitus, it's not because it is because of what we're saying or what you can pick from their periodic investigations. That's why, and it's to help, not that it's a death sentence. So because some people when they hear that,
Yes,
oh, they
because you
think
have
it
to
is.
jab yourself daily. You have to jab yourself daily.
Yeah, I understand. I understand that you have to jab yourself, but there are newer devices that are gentle, that are easy to use compared to the long, scary needles. So
Okay.
there are newer devices that are available, although more expensive.
Okay. So we shouldn't get to that level. We should
Yeah,
make
we
up our mind
shouldn't.
not to get
So
to that level.
prevention is better than cure, really.
Okay. Okay, so you've also talked about, let's talk about hypoglycemia. Sometimes people that are managing diabetics, I know people that have even actually did not die of the diabetes, they now died of
Low sugar
hypoglycemia.
level.
So what will you advise? Is it that they should check their sugar level before they take their medicines? Is it that they should eat very well before they take their medicine? So I've had people go into hypoglycemic shock and they die.
Okay,
And
so very good question. So the issue of hypoglycemia really is a big issue in endocrine world, because when people suffer hypoglycemia over time, it reduces quality of life, even as much as by 12 years. So you don't want people to suffer hypoglycemia as much as possible. So that's why the numbers I mentioned at the beginning is essential. That your normal glucose value is between 70 to 100. So when you know those values, then people would no. The issue is this: I see in many of my patients when I see them in clinic nowadays, the issue of economy comes in. They will tell me, "Oh, because glucose strip is expensive, so I can't check myself more than once a week." Or some people who just check themselves when they're about to come to clinic once in 3 months. But the issue is that many of the oral anti-diabetic agents that are cheap They are the ones that cause lower glucose values and lower glucose value more readily, easily. But they are cheap. They cause, so part of the majority of the side effects is hypoglycemia. That's its low glucose value. The newer agents, they are gentle on the body. They don't cause hypoglycemia like the older drugs, but they are more expensive. So that's where the issues are. So that's where we need advocacy, where government, if there can be a policy to for people with diabetes mellitus, their drugs should be, maybe, I don't know, where our government can help and assist
And do
in
subsidy.
lowering the,
Do
yes,
subsidy. We
because
need subsidy on people bringing it, so they get subsidy from the
maybe
government, and
tax, maybe tax free. I don't know. It's
yes, and they bring
possible.
down the prices.
Yes, because people with diabetes mellitus spend a lot. You see
Mm.
someone with diabetes mellitus spending as much as 60, 50,000 on their monthly medication.
Especially
So
when
for
they're on
this,
insulin.
so for example, for those who don't want to spend as much as that, and they use drugs like sulfonylureas that are cheap, especially gibenclamide, or the trade name is Daonin. Daonin is known to be one of the most powerful anti-hypoglycemic agents you have. But however, we don't give it to people 50 years and above because of decreased awareness of, as you grow old, your attention span reduces. You understand what I'm saying? So you don't want it to be used in an elderly individual who is not going to be aware or can react to symptoms of hypoglycemia. So
Mm.
that's why we try to cut off Downy or gibenclamide from the medications of those who are elderly, so that they won't go into hypoglycemia easily. Now, for us to prevent hypoglycemia, really, based on the question you mentioned, you need to motivate people with diabetes mellitus to check their glucose level more frequently, before food and 2 hours after food. And when you're seeing values lower than 70, you need to contact your physician, or you need to readjust your medication, or they need to readjust your medication to find out what is causing it. Is it based on the reduced amount of food you're eating? Because sometimes it could be reduced amount of food. Like some people may say, "Oh, I don't want to eat too much tonight," and they're still using the same quantity of meal. Sorry, the same quantity of drugs.
Medication.
So definitely that's a recipe for hypoglycemia eventually. So, but if you know that you are not going to eat the same quantity of meal, you need to discuss with your physician so that you can work out how your medication should be. It is easy to adjust your insulin level, but it's not easy to adjust oral medication level. Not easy.
Mm.
That's the truth. So that's
Mm.
why your physician needs to come in and you discuss. For example, there are people who fast and they discuss this and we work it out. Okay, if you're going to fast, then you cannot use this medication during this period. Then you can use this after this period. So these are things that have been known, and there are studies on that, and there are criteria to set to give for people who want to fast, especially Muslim fast. For Christian fast, there's none, because in Christian fast, people don't say. Although I've had Christians who come and say they want to fast and will adjust their medication, but there's no study in that aspect. But for Muslims, we have a lot of studies to help us, to guide us, and there are guidelines to help us during Muslim fast.
Okay,
So for hypoglycemia, to prevent it, we need to check more frequently. And where there's hypoglycemia, you need to readjust your medication so that they can prevent these low glucose values.
it's this is serious. So one of the things that will encourage our viewers and our listeners to do right now is that if you are diabetic, you need to be closer to your doctor. You need to be able to ask the right medication. You need to make up your mind that having your own devices is very important, so that you don't have the problem of. But I also want you to clarify. So you said when someone has an episode of hypoglycemia is
Not
equal
only
to
one.
12 years.
No,
Okay,
not one episode. Frequent
okay,
frequent
okay. Is equal to
episodes.
12 years of what?
It can reduce the lifespan by 12
It
years
can reduce the lifespan by 12 years. That's serious.
over time.
That's serious.
That's quality of life.
That's serious. So,
Yeah.
for everyone on this timeline, please don't forget to share this link with friends and family. I
So
think this
what
diabetes thing, we can't exhaust it in just one webinar. It's quite a lot, and it's some things are becoming clearer to me. as you know, as we're discussing, and the fact that now people in the elderlies are not the elderly patients are not given a particular medication because you don't want them to be disoriented, or you don't want them to fall into hypoglycemic shock.
So
That
another
is
thing I just need to add is that when we have issues with hypoglycemia, or to prevent hypoglycemia, if people with diabetes mellitus are well motivated, they have the resources to monitor themselves, they have social support, that is caregivers, they have everything around them, and they can test themselves multiple times a day, then you give them a particular glucose target to work with to prevent hypoglycemia. But if you have people who are not motivated, they cannot check their glucose level multiple times a day, they don't have the resources. For example, maybe they can only afford one strip per week. Those individuals, you're going to make sure that their glucose values are a little bit relaxed. Now, that means the glucose target will be relaxed. The benefit of relaxing the glucose value is to prevent hypoglycemia. But the problem is that it can promote complications. When you do tight glucose control, you are preventing complications, but tendency to have hypoglycemia is high. That is why multiple testing, the social support system should be in place, then the motivation should be there, then how to resuscitate themselves. So if they have that, then it is easier.
Dr. Lokpade, please tell us symptoms of hypoglycemia, so
Ah,
that sometimes people don't know that they're actually having symptoms of hypoglycemia. I know that an average person, when you have not eaten in a day, somebody like me, when I'm hungry and I'm very hungry, I begin to have a headache, and
you're already mentioning the symptom.
so I tell myself that I've not eaten since morning. That's why I'm having this headache. So I try to eat immediately.
Eat.
Please, can you help us with
So,
symptoms to
so, 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 symptom of hypoglycemia really is sometimes I don't want to make it. There are symptoms that are related to low sugar level getting to the brain, and the first thing is either they present with confusion, they become clumsy, before they know what is happening, they are already in stupor. Sometimes headache that you mentioned. Sometimes they may have seizures. Then sometimes they begin to forget things. Then, if you look at the other side, we call that symptoms. I don't want to start mentioning all these big jargons. We call that adrenergic symptoms. That's symptoms related to how the body responds to low glucose level due to the brain. You see, they start having their heart rate goes up. They become aware. They start having what you call palpitation. That is awareness of heartbeats. Their body begins to shake. Hunger that you mentioned, you start having hunger pants. Then you begin to notice that the body is shaking. You know what I'm saying? At that point in time, or the person is sweating, then that means these are symptoms of hypoglycemia. Now, another thing is that elderly people, as they grow old, all these symptoms may not even show in elderly. That's why in elderly individuals, that's what we're saying, we don't want to have certain medications in the elderly. Elderly people may not even have any symptom at all.
just go into a shock.
Just going
Wow.
to, or when you start seeing elderly people talking out of context, they are beginning to getting disoriented. Try and check their sugar level at that point in time. It may be hypoglycemia. I've seen that happening a lot in clinic, where they're sitting and waiting. You just see, so at that point in time, you need to resuscitate them.
Wow. Wow. So when an elderly person that you're managing for diabetes begins to say things, and you know that this person is disoriented, because
Yeah.
this person might not be sweating, the body might not be shaking, the person might not be falling down, one has to quickly understand the fact that this could be.
Another thing is even the collapse. It can happen. We know they may not even have any symptom at all, and they can pass out. It's possible. So
Wow.
hypoglycemia is a big issue, and we want to prevent that.
Okay. You've also answered some of the question here, that the people have to be on drugs or insulin for life. You said that yes, you said that they might have to take that long for as long as they live. They might have to take their drugs for as long as they live, and that's where the encouragement and social support comes in to help the people. Somebody also asked a question about the age. You've told us that anybody can become diabetic at any time. Is not a respecter of age. uh, and you've also said that for people that have diabetics, maybe a level of empathy and social support can make them accept their the diagnosis, and help them to give them the strength to also make sure that they are fine. We didn't go into details into the different types of diabetes and all that, but we have 10 minutes, so I don't want us to start all the English that one and the science of
The
diabetes. But
type 1, type 2 diabetes,
one
gestational
of
and
the
other
things that
specific.
is
Okay.
instructive now is the fact
Mm.
that when people are in the pre-diabetic stage, it could be prevented or
Yes, you
reversed.
can. Yes, as
And
much as
therefore,
possible.
for as many people that are hearing me, you need to make up your mind to check your blood sugar level. Remember, I said that the fasting blood sugar doesn't have to be between 7 to 9, because that makes some people not to even go and do the checkup, because between 7 and 9, you just don't have the
Sorry,
time.
when you mention 7 and 9, are you talking in terms of
7 to
millimoles?
9 a.m. in the
Oh,
morning.
okay, 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 okay.
So he said it's a state of fasting between 8 hours to 14 hours. If you can have a state of fasting between 8 hours to 14 hours, then you can check your blood sugar level, the fasted blood sugar level at any time. The ideal blood sugar, fasting blood sugar level is between 70 to 100 milligram per dl.
Or you can
If
use
it's
109 depending on one orders organization value between
okay, that
70
we
and
can use
109.
109. But
Yes.
anything above that, whoever you want, the person needs to see the doctor, because if it's not up to 126, it's the pre-diabetic stage, and the person can still reverse it. You've also been able to tell us that our diet could be one of the reasons why a lot of people are having please, can you advise better on the diet? You already mentioned two things that increases the sugar level, but
So
what about the other meals that we eat? I also have a problem with the fact that when people, I remember that when my mom was diagnosed, they said we now should start eating wheat, all kinds of meals restrictions, and
so
it was very tough. I can tell you, it was very tough. It was very tough. She couldn't eat those fruits that she has to eat. We have to start giving cucumber and garden egg, anything that doesn't have so much sugar and all that. It was tough, and I
so
don't
I
know.
so
Can you
when
please
it
help?
comes to yeah. So when it comes to diet, really, this is something that has to be individualized. So because what works for A may not work for B. So you need to, that's why multiple testing will help you to know how you respond to your meal. For example, and the quantity also matters. Processing matters when it comes to diet. For example, some people make it but in a softer manner, some people make it in a harder manner. The quantity I may take may is differ from the quantity you take. So all these things, all these things come into play when you're considering meal. So, for example, the easiest way to know, which so many studies have been done in even our country or even on our local meal, is to read about what we call glycemic index. Although glycemic index does not answer all the question, but it will give us a lot of answers. Glycemic index of meal. For example, what we mean by glycemic index is the rate at which glucose level is released from this meal when you eat them within a 2-hour period. Is it so fast, or is it moderate, or is it so low? Now we have certain food that are low glycemic index meal, like beans, something on legumes generally. So that doesn't mean because they are low glycemic index meal, you should not eat them in large quantity. You should still eat them in moderation. So, for example, if you are the type that like rice and you can't do without rice, which I've seen some of my patients will say, oh, I still like rice. What I advise is that, oh, you're going to take rice, take them with a lot of vegetable, because vegetable has no carbohydrate at all. You can also add beans with it if you want. So you can take rice, beans, and your vegetables together, but in a smaller or in a that's in portion. That's what we call portion control, smaller quantity. For example, a rough guide is assuming your plate, you fill your whole plate up, divide that plate into 4, take 1/4 away, start with 3/4. That person will get used to that 3/4 after a while. Then, if you know that your glucose value is still a little bit high, you're not still achieving the values you want to achieve, then that 3/4, which is now your main plate, divide it into 4 again. Take 1/4 away until you achieve the value you want. Then add more. So you're using the vegetable to substitute the remaining deficiencies or whatever this thing you've lost, so that you can get filled easily. Then again, when you eat, especially in this part of the world, we eat small in the morning. Some of us even skip breakfast. And let me even mention that skipping breakfast is also a risk factor for developing diabetes mellitus. We may not even go into that, but you must remember, yes, skipping breakfast. There are studies
Ha.
that have been done to find that out. Me too, I used to skip breakfast in the past, but nowadays, whenever I'm not fasting, I eat my breakfast as much as
Okay,
possible.
eat your
So
breakfast to avoid
because the
diabetes.
reason the reason is because when we skip breakfast, we tend to eat too much in the afternoon and in the evening. And in this part of the world, we eat heavy in the evening.
Hmm.
We're supposed to be the other way around. We're supposed to eat heavy in the morning so that you can burn it throughout the whole day as you're working, and eat light in the evening. When you eat heavy in the evening, half of it is going to be stored as fat because you're not going to burn it. You're going to sleep immediately. So your body is going to process it and turn it into fat, and you store it. That's why we're adding weight easily. So we need to begin to, and that's why the Western world, they eat heavy in the morning. They either say eat like a king in the morning, I eat like a pauper in the evening. And if you look at it, insulin regimen is tailored towards that. You'll find out that in some of my patients, what I do is that I reverse that insulin regimen for those who eat heavy in the evening. I give them more insulin in the evening, light insulin, a small quantity in the morning, because they can't do without eating heavy at night.
Wow.
So we need to change our eating pattern. For those of us who are still able to prevent, don't eat heavy at night, and don't eat late into the night.
And eat breakfast.
So, and even when you eat, you should try and burn it. Especially, like, I try and work, make sure that my last meal is around 7, and before I sleep, that will be at 10 or 11. At least I must have make sure that at least I've burned majority of all this meal.
Okay. Thank you, Dr. Olopade. So he also told us about the glycemic index of meals. Some of us can research into that, especially those of us that diabetic and trying to prevent if you have a hereditary factor and you're predisposed to it. We could check the glycemic index of meals. He does not want to prescribe one thing for all of us. What he said is that it is individual. It has to be individualized. So he's not ready to say this is what you should use or this is not what you should use. But for us, we should make up our mind to also eat our breakfast. Eat breakfast, eat very well in the morning so that you can burn the fats that
The
could be
food
stored as
throughout the
a
whole day.
result, yes, of the food that you have eaten. And in the night, eat small so that you don't have too much stored fat. One of the things you've also told us is about physical activity. The causes of diabetes are multifactorial. One of the leading causes of diabetes in the country right now is hypertension, and he's also saying that there's so many things that causes it. So for the main fact that it can be prevented, which is one of the work that some of us have decided to work, the kind of work we decided to do, because we already know that we're predisposed to it, is to ensure that we do not indulge in excessive alcohol, indulge in smoking, ensure that we take care of physical activity, watch what we eat, because right now you have said it that lifestyle can actually help all of us. Lifestyle
So,
modification
and
can
if you
help.
look at the best form of diet, this Mediterranean diet, it is composed of, not that you're cutting down carbs, but good carbohydrate source, fruits, vegetables, olive oil. That's what they eat. That's why it is one of the best meals. So there's nothing that says you cannot eat fruits. Even people with diabetes take fruits. They can take vegetables, but it's portion control that is the most important thing, so that you don't eat beyond your limit and your capacity. And for the medications you're also taking too.
Thank you, Dr. Lopade. I don't want us to always
Okay.
exceed and hard. This is very
Mhm.
instructive. It's a lot, and
Mhm.
I've gained a lot, even though I've read so much about diabetes. What I've gained in this last one now is much more than what I've read. It's a lot of it's a big syllabus. I can say that because I know that I've studied a lot about it. Thank you for having us. For everyone that is listening to us, please don't forget to share this with friends and family. This is instructive. Please eat breakfast. Try to know that these things are preventable, and know also that a lot of people are coming down with diabetes in their 30s. And diabetes does not come alone. We did not share the complications that comes with diabetes. One of the complications is chronic kidney disease, which I know that some people have because they have
Mhm.
diabetes. We didn't share. There's so many parts of this diabetes that we did not talk about, but these few ones that we've talked about is what we should also take care of. He has said that if you are between 40, if you are above 40, don't don't take it don't forget to always check your blood
Yeah.
sugar status. Check your blood sugar status. There are tests that could be done, and if it's done twice, you if the doctor or the lab scientist share any figure with you, you can actually flag it, and try to dig deep and know what it is. Because as at the time someone is that being diagnosed of diabetes, there could have been complications, especially to the major vessels. And if there are complications, and I think that's one of the reasons why some people just collapse these days, and we're wondering what happened. This guy is healthy, yes, he's healthy, but some damages are already going on in the person's system. And that's one of the reasons why we're creating awareness through this webinar. We're creating awareness so that people can know that some of these illnesses can be prevented. We had a lot of people that had COVID-19 because they had diabetes. They don't say, the person had diabetes, that's why the person died, and the person had just COVID-19. So that means diabetes is not something, and people that had hypertension actually survived. But most people that had diabetes, they had a lot of complications with COVID-19. So meaning that there's some diseases that are not communicable like COVID-19, but the impact on our lives are much more and than we could even think about. And if you're on any medication, please, he has said it, that you might have to manage this medication for the rest of your life. We need to be faithful to them. And we are having issues with those medication. It's another opportunity for us to seek the medical advice, seek the doctor's advice, and allow we need to learn to just gist with our doctors and ask questions about our status. That will help, because they also are looking for people to ask them questions. Sometimes you can't tell someone everything, but when the person is asking questions, it's easier to now shed more light on it. Thank you, Dr. Lopade. And
Thank
something
you.
happened in the course of this month. We launched our Wellness Plus app. If you're on this webinar, there's Wellness Plus app. You can book for your medical checkup on Wellness Plus app. You can book for your medical checkup. He has said it. Even if you are not feeling sick, even if everything is well, you're not having polyuria, you're not taking water every time, is an opportunity for you to do your medical checkup. People that are well should do medical checkup. Don't wait till the doctor is recommending you to go and run some tests. When you do the medical checkup, you can know your fasting blood sugar as well level.
Let me also chip this in. Type 2 diabetes mellitus may not even present with symptoms at all. By the time they're presenting with complications. So that's why people may come down with stroke, with kidney problem that you mentioned, infertility problems, and ulcers. So many things, miscarriages. So
So if you are 35 and above, go on Wellness Plus app today, or go on wellness website and go and book for a medical checkup. You need to do a medical checkup. It's on Google Play Store as well, because that can help to know what is happening before it becomes too bad. Because this can be reversed, it can be prevented, and we should not allow such non-communicable diseases to destroy health. He has said it's almost one in every two persons is now diabetes now. Is that what he said?
no, for hypertension.
For hypertension, one in every
Almost
two
45% of from the study that was done recently.
is
So
hypertensive. So we really need to take care of ourselves. We need to be alive, and we need to thrive while we're alive and not be sick. So thank you very much. Don't forget to don't forget to follow us on our social media pages, wellness_care. And I also plead with you to please follow us on our social media page, subscribe to this YouTube channel, so that you will be the first to know when we are having the next webinar. It's already an hour. I promised everyone that it's going to be an hour. So thank you, Dr. Lopade. Thank you for being on this timeline. We might have to call you back because there is a lot to ask, and the vibration was too much. I couldn't even cut you off or make you slow down. Thank you for this educative webinar. The weight thing is still coming up. We need to make sure that our weight, we have an healthy weight if we want to have an healthy blood sugar level. So don't forget that your weight is very important. The fat level in your system is very important to know how your insulin works. And thank you, Mr. Joshua. Thank you for always being there. For everyone, don't forget to share this. Thank you very much. And to my
Thank,
crew in wellness, I would say thank you for making this possible. Thank you, sir.
thank you for having me.